Most men don't notice the change at first. 20 minutes used to be enough, then it became an hour, then a few hours. Now, for some, it's the next morning. Or longer. And here's what makes this particularly difficult to talk about. Most men assume it's about desire, or stamina, or interest. It's not. What's actually happening is far more biological than that, and it's been quietly progressing for years. I'm Dr. Emily Carter, board-certified urologist. Over the past decade, I've worked with thousands of men navigating age-related changes in sexual function. And one of the most misunderstood aspects of male physiology is this: the refractory period, the recovery window between one response and the next. In your 20s, this window might have been minutes. In your 30s, maybe 30 to 40 minutes. By your 50s, it could be several hours, and past 60, for many men, it's measured in days. This isn't talked about openly, not in locker rooms, not even in most medical offices, but it's one of the most consistent patterns I see. And what most men don't realise is that this lengthening recovery time isn't just about rest, it's about chemistry, it's about nerve signalling, it's about how your brain and body communicate after climax, and those systems change profoundly as you age. So if you've been wondering why recovery takes longer now, why your body doesn't respond the way it used to, even when desire is still present, this is what's really happening. And by the end of this conversation, you'll understand not just what's changing, but why. Because once you see the mechanism, the frustration starts to make sense. Let's start with what most men experience but rarely mention. After orgasm, there's a period where arousal simply isn't possible, no matter what. The body has entered a biological cool-down phase. In younger men, this phase is brief. The system resets quickly, but as decades pass, that reset takes longer, much longer. And here's what makes this so confusing. Desire might still be there. Mental interest might be fully intact, but the body doesn't respond. This creates a disconnect, a gap between what the mind wants and what the body can deliver, and most men interpret this as a loss of virility, a sign that something fundamental has weakened. But what's actually happening is far more specific than that. Your refractory period isn't about strength, it's about neurochemical recovery, and that recovery process slows down with age in very predictable ways. Think of it like this. After climax, your brain releases a flood of chemicals designed to shut down arousal pathways. This isn't a malfunction, it's protective. Your body needs time to restore balance, to reset the nervous system, to clear certain hormones and neurotransmitters. In your 20s, this process might take 15 to 20 minutes. By your 50s, it can take 8 to 12 hours. By your 60s, sometimes longer than a day. And here's the part most men never learn. The length of your refractory period is directly tied to how efficiently your brain can clear one specific hormone: prolactin. After orgasm, prolactin levels spike. That spike is what temporarily suppresses arousal. In younger men, prolactin clears quickly. The system rebounds. But as you age, prolactin lingers. It stays elevated longer. And while it's elevated, your body simply cannot generate another full response. Now this is where the misunderstanding deepens. Most men think the problem is testosterone. Low T gets blamed for everything. But testosterone levels don't explain refractory period lengthening. You can have perfectly normal testosterone and still experience this. Because the issue isn't hormone production, it's hormone clearance, it's receptor sensitivity, it's how quickly your system can transition from one neurochemical state to another. Let me explain what happens in stages. Immediately after orgasm, your sympathetic nervous system, the fight or flight system, is highly activated. Heart rate spikes, blood pressure rises, muscle tension peaks. Then within seconds, your body flips. The parasympathetic system takes over. This is the rest and digest mode. Your heart rate drops, blood vessels relax, and prolactin floods your brain. Prolactin acts like a brake. It binds to dopamine receptors in the brain. Dopamine is the fuel for desire and arousal. When prolactin blocks those receptors, dopamine can't activate them. And without dopamine signaling, arousal pathways stay dormant. This is the refractory period, a prolactin-induced arousal suppression phase. And how long it lasts depends entirely on how quickly your body can metabolize and clear that prolactin. In your 20s, prolactin clearance is rapid. Your liver processes it efficiently. Your dopamine receptors are sensitive and numerous. The system resets within minutes, but after 40, several things change. Prolactin clearance slows. Your liver becomes less efficient at processing certain hormones, and dopamine receptor density begins to decline. Fewer receptors, slower clearance, longer suppression. The refractory period extends. This is compounded by another factor, dopamine receptor sensitivity. Even when prolactin levels drop, if your receptors are less responsive, it takes more dopamine to activate arousal, and dopamine production itself declines with age. So you're dealing with a double challenge: less dopamine being produced, and receptors that require more dopamine to respond. There's also a third mechanism at play: oxytocin and vasopressin. These are the bonding and satiety hormones released after orgasm. In younger men, these hormones create a brief sense of satisfaction, then fade. But in older men, oxytocin and vasopressin remain elevated longer. This extended elevation deepens the sense of satiety. The body feels content, fulfilled, and that neurochemical contentment suppresses the desire to repeat the experience. Think of it as your brain saying, "We've achieved what we set out to do. Now we rest." In your 20s, that message lasts 20 minutes. In your 50s, it can last 20 hours. Because the hormones responsible for that message clear more slowly, and the receptors that register satisfaction become more sensitive over time. Now, here's what this looks like in real life. A man in his mid-50s comes to my office. He says, "Doc, I'm still interested. My wife is still interested. But after we're intimate, I feel done. Not just physically, mentally, like my brain has switched off." He's not describing low libido, he's describing elevated prolactin, oxytocin, and vasopressin. His refractory period isn't just physical, it's neurochemical, and it's lasting days instead of hours. This is where frustration builds, because from the outside it looks like disinterest, like the relationship has cooled. But internally, the man is fully engaged. He just can't override the chemical brake his body has applied. And that creates guilt, confusion, a sense that something has been lost that can't be explained. Most men never hear this framed in biological terms. They hear, "It's just aging, it's normal, don't worry about it." But that explanation doesn't help, because normal doesn't mean unchangeable. And understanding the mechanism, understanding what's actually slowing the recovery, changes how men approach the situation. Let's go deeper into the nervous system component. Your arousal response depends on a seamless transition between two opposing systems: sympathetic and parasympathetic. During arousal, the parasympathetic system drives blood flow, relaxation, engorgement. During climax, the sympathetic system takes over, contraction, release, ejaculation. Then, post-climax, the parasympathetic system must return to dominance to allow arousal to build again. In younger men, this flip happens quickly. The systems communicate efficiently, but after 50, that communication slows. The sympathetic system, activated during climax, stays partially engaged longer, and while it's engaged, the parasympathetic system can't fully take over. This creates a state of partial tension, not quite relaxed, not quite activated, and in that in-between state, arousal cannot rebuild. This is also why stress makes refractory periods longer. Chronic stress keeps the sympathetic system on alert. Even when you're not consciously anxious, your nervous system remains partially activated. And that baseline activation extends the time it takes to return to a parasympathetic dominant state. So stress doesn't just lower libido, it extends recovery time between responses. Now let's talk about androgen receptors. Testosterone binds to androgen receptors throughout the body, including the brain. These receptors influence dopamine activity, arousal sensitivity, and recovery speed, but androgen receptor expression declines with age. Fewer receptors means testosterone, even if present in normal amounts, has less impact. The signal weakens, and one of the first places this shows up is in refractory period lengthening. Some men have naturally high androgen receptor density. These men maintain shorter refractory periods well into their 60s. Others have lower density. For them, the lengthening starts in their 40s and accelerates through their 50s. This is why two men of the same age can have drastically different recovery times. It's not about effort, it's about receptor biology. Then there's sleep. REM sleep is when the body clears metabolic waste from the brain, including excess prolactin. If sleep quality declines, prolactin clearance slows. And if prolactin stays elevated longer, the refractory period extends. This is why men who sleep poorly often report longer recovery times. It's not psychosomatic, it's metabolic. Poor sleep delays the neurochemical reset. There's also the cumulative effect of repeated activation. In younger men, frequency has little impact on refractory period length. The system recovers quickly regardless. But after 50, frequency begins to matter. Each orgasm depletes certain neurochemicals: dopamine, acetylcholine, norepinephrine. If those reserves aren't fully restored before the next activation, the system responds more slowly. Recovery takes longer, and if this pattern repeats, the baseline refractory period can lengthen over time. This doesn't mean abstinence improves function. It means the body needs adequate recovery time between responses, and that time increases with age. For some men, this might mean spacing intimacy differently than they did in their 30s, not because desire has changed, but because biology has. Now, here's something most men don't consider: medications. Many common prescriptions affect refractory period length. Antidepressants, particularly SSRIs, increase serotonin and suppress dopamine. Blood pressure medications can alter autonomic nervous system balance. Even antihistamines can slow acetylcholine signaling, which plays a role in arousal recovery. If you've been on any of these medications for years, they may be quietly extending your refractory period without anyone making the connection. I've had patients come in frustrated, assuming the issue is hormonal or vascular, but when we review their medication list, the answer is there. They've been on an SSRI for a decade, or a beta blocker for blood pressure, and those medications, while medically necessary, are altering the neurochemical environment in ways that directly affect recovery time. This is where the conversation becomes more complex, because you can't simply stop medications. But understanding the mechanism helps manage expectations. It reframes the experience. The lengthening isn't a failure. It's a side effect, a predictable consequence of how certain drugs interact with arousal chemistry. Let's also address something rarely discussed: the psychological component. Anticipation. When refractory periods lengthen, men begin to anticipate failure. They expect the next attempt to take longer, or not work at all, and that anticipation activates the sympathetic nervous system. Stress hormones rise: cortisol, adrenaline, and those hormones further suppress parasympathetic arousal pathways. The expectation of delay creates the delay. The refractory period becomes a self-fulfilling cycle. This is not imaginary. It's neurochemical. Anxiety directly impacts dopamine availability and prolactin clearance. So men trapped in this cycle are experiencing both biological and psychological lengthening. And breaking the cycle requires addressing both, understanding the biology, and reducing the psychological load. Now here's what most men want to know. Can this be changed? Can the refractory period be shortened? The honest answer is, partially. You cannot return your neurochemistry to age 25. But you can optimize the variables that influence recovery speed, sleep quality, stress management, medication review, dopamine support through nutrition, reducing prolactin elevation through specific lifestyle adjustments. But there's no pill, no supplement, no quick fix, because the refractory period isn't a disease. It's a natural biological process that slows with age, and trying to force it, trying to override it chemically, often creates more problems than it solves. The better approach is understanding, acceptance, and working with your biology instead of against it. Some men tell me, "I wish someone had explained this years ago. I thought something was broken, but it's just time." And that's the truth of it. Time changes the neurochemical environment. It slows clearance rates, it reduces receptor sensitivity, and those changes show up as longer refractory periods. It's not weakness, it's biology. But here's what concerns me. Most men never get this explanation. They assume the problem is desire, or attraction, or relationship quality. And those assumptions create distance, create guilt, create frustration in partnerships that are otherwise strong. Because the body is responding to chemistry, not emotion. And when that distinction isn't clear, everything else gets blamed. The refractory period is one of the most consistent markers of male aging, more consistent than testosterone levels, more predictable than erectile quality, and yet it's almost never discussed in clinical settings. Men are left to figure it out on their own, to assume the worst, to believe something has been permanently lost. But what's actually happening is transition. The system is adapting to a slower neurochemical recovery cycle, and if that cycle is understood, it can be navigated, not reversed, but navigated, with patience, with communication, with a realistic understanding of what the body needs to reset. So if you've been noticing this change, if recovery takes longer than it used to, if the window between responses has been gradually widening for years, you're not alone, and you're not failing. You're experiencing one of the most predictable patterns in male physiology, a pattern driven by prolactin clearance, dopamine receptor sensitivity, autonomic nervous system balance, and androgen receptor expression. The body always adapts, until it doesn't, and the refractory period is one of the first places that adaptation becomes noticeable. Most men don't connect these dots early enough. They wait until the delay is measured in days, until frustration has already built, until the pattern feels irreversible. But awareness, even at that stage, still matters, because understanding what's happening changes how you respond to it. Your recovery time isn't a reflection of your vitality, it's a reflection of your neurochemistry, and neurochemistry, unlike desire, operates on its own timeline, a timeline that lengthens with age, gradually, predictably, and almost always without explanation.